Hey guys, welcome to part one of our new series, Anatomy Focused Laser, or Laser Focused Anatomy. In this series, we're going to break down the entire body, going from head to tail. We're going to look at the anatomy, common conditions, and then how we actually apply laser therapy to those conditions to make sure that we're getting the best treatment possible for our patients. In this first video, we're going to start looking at the overall head anatomy, and then over the next few weeks, we're going to break it down to ears, the mouth, the brain, and kind of start digging into, again, the anatomy and how we can treat those conditions. So just looking at the skeletal structure. So to begin with, we have the frontal bone, which is kind of the big part of the bone at the front here. We have the parietal bone that sits kind of in this larger space where you can see the ear at the back. We have the occipital bone at the back and the occipital crest that we all kind of palpate and can feel. Then we come down, it gets a little bit more complex down here. So we have the temporal bone, the sphenoid complex that goes into the zygomatic arch across here. We have the orbit, which is where the eye sits. We have the lacrimal bone just underneath that, often where, our tear ducts sit. And then we have the maxilla, which is essentially, the big part of the upper jaw. Then we go into the nasal bone that sits at the top here, and then the incisive bone at the front. And then we have, which I've rubbed off with my fingers, the maxilla, which is the lower jaw. Now for the muscles, this is the best model I've found to show you guys, but I'll pop up an image here as well. So the major muscles, we have the masseter, which is the big round one here. We have the zygomaticus that goes across here. The buccinator, levator nasotibialis, the malaris, the orbicularis, which is the one that goes around the eye, and the frontoscularis at the top. We also have the digastricus, which is underneath, which I'll show you in the longer videos if you check that out. So let's deep dive these muscles and see what they do. So the frontalis, which covers a large portion of the head here, at the front over here. So this fixes and pulls the scutiform cartilage rostrally. We then have the orbicularis oculi, which is the one that goes all the way around the orbit. So it forms a ring around the eye and it puckers the eye and helps to close it as well. And then we have the buccinator, which is this one kind of over here. It's cheek muscle, and that helps to manipulate food. Then we have the temporalis. So the frontalis is the one kind of, it's big one more at the front. The temporalis is kind of more at the back here. And again, it's a big muscle that sits over there. And that helps to elevate the mandible, the lower jaw, and helps to close the mouth. We have the masseter, which is this, again, big one, and that helps to elevate the mandible to close the mouth as well. And then we have the digastricus, which is kind of underneath here, and that depresses the mandible to, again, open the mouth. We also have the pterygoides, which you can't see on here. It sits behind here, and that also helps to elevate the mandible to help close that mouth as well. So that's a range of a few of the muscles and just some of the jobs they do. There are a lot more, as you can see. There's so many little muscles there in detail, but those are the major ones that we talk about when it comes to the head. Now, what about all those nerves? Now, I don't have a great model that show you all the nerves, so I'll pop up again a picture here. So we have the olfactory, the optic, the oculomotor, the trochlea, the trigeminal, which I know a lot about, the abducens, the facial, the vestibulocochlear, the glossopharyngeal, the vagus, the accessory, and the hypoglossal 12 key nerves that help with all things facial, whether it's movement, action, or sensory. What do those 12 nerves do? So the olfactory helps with smell, the optic helps with obviously vision, the oculomotor helps with eye movement and pupil constriction. The trochlea is eye rotation. The trigeminal is facial sensation. So again, those of you that know, I have trigeminal neuralgia. So I have issues with my trigeminal nerves. So I get intense pains across my face, electric shocks, burning. The sensation honestly is not nice. It's one of the most painful conditions in the world. High medication and laser therapy is what keeps me able to function and talk to you right now. So we don't tend to see trigeminal issues so much in canine, but in equine, I believe we do tend to see more trigeminal issues there. So that's an interesting one to know about as well. The abducens is eye abduction. The facial is facial expression, tear and saliva production. The vestibulocochlea is for balance and hearing. The glossopharyngeal helps with swallowing, with taste and with salivation. The vagus is a parasympathetic control of thoracic and abdominal organs. So interesting, you know, something up here affecting down there. Very interesting when it comes to our laser therapy. The accessory helps with neck and shoulder movement, and the hypoglossal helps with that tongue movement, which again, very important with our animals. So those are the 12 major nerves, and kind of just a little bit of an insight as to what they all do. So again, really interesting when we get towards using our laser, if we know that certain nerves will impact what we're trying to achieve with certain conditions, that's really good to know the location of those nerves so that we can help stimulate them using our laser devices as well. So that's our overview of the head, and again, there's so much more detail we can go into, but I just wanted to do an overview, and then as we go along the next few weeks, when we look at the brain, the ears, the mouth, etc., we will break them down further. So next video, we're going to start looking at the brain anatomy. The video after that, we will then look at common conditions affecting the brain, and then we'll start getting into our laser tips. And we will do this same thing for each body part. So like I say, we're starting with the head. We're then going to go into the spine. We'll start going into each limb and each, joint that's impacted. We'll go into the thoracic cavity and the abdominal cavity. So this is going to be a long series, but I wanted to do it justice and go into depth with it. So I hope you come along for the journey. Please like, comment, follow, share, all those good things, because that's what helps me bring you more video content. And if you want the longer version of these videos, they are on our YouTube channel at Emily Ashdown, the laser trainer. So please check out kind of over there, as I'll keep the shorter versions on Instagram and Facebook just to help kind of give you guys insight as to what we're doing. So hope you enjoyed that, and we'll see you in the next video looking at the brain.